Ya Ali Madad. Aga Khan Health Board welcomes you to our podcast series. Today, the spotlight is on ADHD, Attention Deficit Hyperactivity Disorder. Today, we have two very esteemed guests tonight. We're really fortunate to have both of them together. Dr. Shermina Sayani, who's a consultant pediatrician, and Dr. Asif Bachlani, our consultant psychiatrist, who has recently won an award for being the best psychiatrist in the country by the Royal College of Psychiatry. Without further ado, I'm not going to take up too much of your time. I'm going to hand it over to our guests to introduce themselves. Thank you. I hope you enjoyed the talk.
And so we're really grateful that the Health Board have asked both of us to speak. So I think we thought it would be really helpful to talk about who we are. So Shermina, we've already heard that you're a consultant paediatrician, but tell us a bit about yourself.
So I am a consultant paediatrician. I specialize in child development and in particular in neurodiversity. And I diagnose children with autism, with ADHD. I've been a consultant for about 8 years. And I have, I guess, what you would call a portfolio career now. So I have a bit of a mixture of things I do. I work for the NHS. I work at Great Ormond Street Hospital. I also work, oh, look, our clock is so excited. It started making all these noises. That isn't, oh, I see. I set it for 45 seconds, not 45 minutes. You'll start to understand some of the issues here in a few minutes. Okay, so while I'm setting the clock, as well as doing NHS work, so two things at once is quite hard for me to do, but we'll get there. We'll get there. I also work in private practice, and I do a little bit of something a bit different. So some of you may know, about 10 years ago, I was quite involved in the Jamaat in writing and directing plays. In fact, writing and directing plays that were performed here. And now I'm doing a master's degree in applied theatre. So that's another, which is a kind of theatre for social change. So that's me. And the other very important thing about me, I suppose, is that I also have a diagnosis of ADHD, of Attention Deficit Hyperactivity Disorder. So you are getting a little bit of the kind of clinical expertise and a little bit of me as well, I hope. And the reason that I'm here is that my very esteemed colleague, Asif, said, oh, do you want to come and join this podcast on ADHD? And I was like, yeah, oh, yeah, that sounds a good idea. Yeah, let's do it. And then in between that time, he goes and wins some enormous national award for the Royal College of Psychiatry. And so now I'm feeling slightly inadequate sitting next to him. But that's okay. We'll manage. So I think, Asif, you tell us your story. It would be really good to hear about you.
So in a similar way, I'm a psychiatrist. I treat and support people with ADHD and autism. I'm a general adult psychiatrist, and that means I support and treat people over the age of 18. Clinically, I work predominantly in the private sector, but I have done a lot of NHS work along the way. A bit like yourself, and maybe it's an ADHD thing, I'm a portfolio psychiatrist, so I do not only clinical work, but I've done things around digital transformation, population data health, and have lots of different interests, but I think that's probably an ADHD thing. And the other thing I share is that I also relatively recently got diagnosed with ADHD 2.5 years ago.
So I think I was about a year ago and you were 2.5 years ago, hence the timer, because we could absolutely overtalk. So we apologize for that in advance. So I think probably we can start a little bit with what is ADHD? And maybe, Asif, can you explain kind of some of the criteria, like how does it get diagnosed, all of that?
Of course. So I think I'm going to talk about what it's like to diagnose an adult. Obviously, that's my area of expertise, yes? So, in essence... Oh, can you not? Okay, so I am a bit softly spoken. Adult ADHD, obviously you'd be over the age of 18 to get that diagnosis, but it's kind of two main criteria. One is inattention, and the other one is hyperactivity and impulsivity. There are different types of ADHD, and we'll obviously cover that a little bit later. But in essence, it's what's called a neurodevelopmental disorder. That's a long-winded way of saying it is a disorder of brain development, which again is a long way of saying you're in essence born with it. Yes? So the vast majority, if not almost virtually everyone, it's a genetic basis, which means it runs in your family. Yes? So apart from having those criteria, it's supposed to happen over at least two domains. So again, as an adult, that ends up being work and uni and your personal life. Yes? If it's only on one domain, it's unlikely to be ADHD. And again, because I treat people with adults, all of those symptoms are supposed to start before the age of 12. Yes? And then the final thing when you're ending up seeing a specialist like me is, could there be another condition that explains the ADHD? Yeah? Perhaps a more simplistic way of looking at it, or a really good analogy, is from one of my favorite psychiatrists in the US, who describes ADHD like this. It's like having a Ferrari engine with bicycle brakes. Yes? So I think most of us would love to be a Ferrari, but the problem ends up being is when our braking system isn't as good. So one of the advantages of getting a diagnosis is you try to work on that braking system. That's my perspective as an adult psychiatrist, but obviously it presents differently. Shermina, what's your experience of children and being diagnosed?
So it's a little bit different in children in the sense that the criteria are the same. So what we're looking for is we're looking for children who have difficulty. We use this word inattention. What we mean is focusing, yeah, being able to focus on something. And when you're a child, that will be learning in the main part, right? So being able to focus on that. And we might also be looking for hyperactivity and impulsivity. So hyperactivity is a lot of moving around, okay? More than would be expected for your developmental age. So if you look at your average toddler, they love to move around, okay? And they love to jiggle about, and that's actually part of what we would say is typical development. So ADHD doesn't tend to be diagnosed until you get to around the age of 5 or 6, where you can say, well, actually, is this hyperactivity because of typical development? Probably not now, because they're sort of growing out of that period. And if you're still seeing some of these symptoms, then we'll start thinking about that diagnosis. The other thing that we look for is impulsivity, okay? So that thing of doing things without thinking about it, all right? Just kind of not having that filter, doing things almost immediately. And in children, what we're looking for, obviously we know that it's developing in children. We are looking for evidence from two domains as well, 3 domains actually, really. One is the home environment, so parents' story about their children. The other is the school environment. So often if you go to a clinician, they will do some questionnaires, some information from the school to find out actually how are they coping, are they able to focus in school, or is this condition impairing them? Is it making it more difficult? And I just want to come back to that thing about impairing, because the symptoms that we're talking about today, you will see across the population, okay? You might recognize some of these things in yourself, all right? That doesn't mean that everybody has ADHD, and that's a really important thing. What we look for as clinicians is it impairing them in their ability to engage with life, yeah? Is it making it difficult for them to engage with life, and whatever life may be? And when you're a child, it's about school, isn't it? And then we also, I tend to also observe the child myself, right? So we would have a nice observation clinic where I can actually see, are they inattentive, daydreaming, halfway through? Are they finding it difficult to focus? Are they moving from activity to activity? So that's probably how the diagnosis is a little bit different in children versus adults. Yeah.
And actually, it's really important to say that actually it is on a spectrum. So as Shermina said, technically everyone has ADHD traits. So the analogy I often use with my patients is blood pressure. So we've all got blood pressure, yes? But it doesn't mean we've all got high blood pressure, yes? So there is a line, isn't there, between that says over a certain amount of your blood pressure, you've then got a diagnosis of high blood pressure. In the same way with ADHD, yes? There is a line, and over that line, you then get a diagnosis. You can also have people who are borderline. Yes, you can have borderline high blood pressure, borderline high glucose, borderline ADHD. And that's where the diagnostic tests are. And obviously the diagnostic tests that we use in adulthood are different to the ones that we use in childhood.
Yeah, so we might use a questionnaire, I think, and they'll be designed differently for adults and children because we engage with different kinds of activities. Sometimes we use, I don't know if you've been using this in adults as well, but we use a test now called a QB test, which is like this new kind of electronic test that objectively, inverted commas, looks for hyperactivity and inattention by getting you to kind of focus on a game, right? Clicker, a certain number of times, and it watches how much you move. I did that test on myself, actually, and realized it compares you to the population for your age and your gender. And I was 99th centile, basically, for inattention and 97th centile for hyperactivity. So that's good going, okay? That's good going, ADHD. But what I probably was doing, which we'll talk about a little bit, was I was masking my difficulties. And I think that's something that it would be interesting to talk about. Now, we did say there are different presentations. We talked about children and adults. I think it might be helpful to talk a little bit about us and how we presented, because I don't think we're typical, particularly for our gender, we're not typical. So maybe Asif, did you want to talk a little bit about your experience?
Absolutely. So I mean, I guess with my diagnosis, it's predominantly the inattention subtype. Yes. So there are three main subtypes that you see. There's the hyperactive only, which I don't see as an adult psychiatrist. It tends to get picked up by paediatricians or CAMS psychiatrists, so under 18 psychiatrists. The common types that I see are inattention and combined types, so both hyperactive and inattention. But actually my type is inattention. And so classically, when you think about boys, you think about hyperactive boys. So the sort of questions I ask people are, did you climb up trees? Did you run around in restaurants when you shouldn't have been doing? Did you jump on the sofa? And that wasn't me. And so part of the reason why people can be missed is if you don't present perhaps classically for your gender, which would be hyperactive and inattentive, it can be missed. The other terminology that's often used by ADHD psychiatrists is scaffolding. So scaffolding supports you, and so can mean that actually your ADHD doesn't present until later in adulthood. And not so well accepted in the UK, but in America they even talk about adult onset ADHD, that you don't actually have to have any symptoms in childhood and your onset can only be adulthood. Not quite accepted in the UK yet, but at least in the US, and the US tends to lead and we tend to follow in that way. So my scaffolding was my parents. I went to a private school, so all of that really helped me because in essence, you're kind of told what to do. And there were times in my life, so university is a really good example, where I ended up being self-directed learning. So my grades dropped quite a lot from the first couple of years where I was still in that kind of private school routine to basically C's along the board because I was self-directed learning. And I remember writing one of my dissertations 36 hours before it had to be submitted. And that's classical lastminute.com procrastination. Yeah? So actually, you could see someone like me being missed because I'm not hyperactive, I'm not overtly sporty, I'm not running around. Yes? And so it's important to take that on board. What about Shermina, women? And how do women generally get diagnosed? And could we compare and contrast that to you?
Yeah. So I think women are interesting. So first of all, a really key thing is, historically, we used to think that ADHD was more common in boys. And I think we thought that because it was more obvious and we were picking up the hyperactive, impulsive type, right? And if you think about teachers, right, if you've got a nice daydreamy kid that doesn't cause too much mischief, it's unlikely that they're going to say, hey, there's a problem. Whereas the hyperactivity element of it might be picked up more. And in general, though I think Asif and I are kind of the opposite of the in general, boys tend to present more with the hyperactivity. And you could question why. And girls and women tend to present more with the inattentive type, or at least as they get older, you will see that. The story, I've been reflecting really on my childhood. It's a very cute picture. Where's the, look, there's no like audience response going on here, right? So this, thank you, exactly. Right, so this is Shermina, age 3, and as you can tell, I mean, there's not much change really. If you actually look at this picture in detail, it tells you a little bit more of a story. So this is my late father, and he doesn't look very happy at this birthday party, really, does he? He looks like, and this is what he's doing, that he's actually holding me back from the cake with the alarming candles and the frilly nylon dress so that I won't catch fire, essentially. And the other hand that you can't see is my cousin, my elder cousin, who's also holding me. And I think this was sort of a theme of my childhood. My father and various other people. My father had a phrase. He used to say, Shermina, don't trip on the where. Not why or where. I don't know why. But he always used to say that. And I think it came from having a little girl who was everywhere. Okay? In everything, doing everything. Lots of masti. You know, I mean, literally, you can't even... I'm not that nice girl with the nice dress. You know, I'm about to catch fire. And so I think he tried to pull me back. And probably because, we're going to talk a little bit about this, my father was a very daydreamy kind of guy, and I probably got it from him. And so he a little bit understood me. But I think what happened is, over time, because of the social norms, that the social expectations of girls and women, this jungly became much more sensible. And if anyone knew me when I was growing up in Jamaat Khana, you know, I was a good girl. I worked hard to be a very, 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 very good girl, okay, in the perception of what a good girl is. And I think that is what I would describe as masking. And it's challenging because, you know, these things, they don't disappear, they just hide under the surface, okay, and then they come out in other ways. And I think that's the challenge. So that was my presentation when I was little. And then I got diagnosed about a year ago when I was burning out at work. And I think when we talk about burnout, I think it's because I was masking some of my symptoms, which is often the way that you see women present. Like they're not really being themselves. They're being sensible and good and not jiggling about a bit. So yeah, so that's my kind of presentation. This way.
And generally, women are much better at masking than men. So often women get misdiagnosed, underdiagnosed, and that's not true. So that's not only true for ADHD, but it's also true for autism. So women's, I guess, social skills or the ability to mask is better than men. So men get to get picked up a bit more easily, which is where that stat comes from. There are more men than women that have diagnosis, or more boys than girls. But interestingly, if you fast forward to 18, there's no gender difference. And I think in reality, the research is just incorrect. And the reality is it's a very common condition, which is probably as diagnosed in women as men, or boys as in girls.
So I think we are understanding more about ADHD now. And people ask this question, Asif, I've had this before, you know, is it just a vogue diagnosis? Is it just, you know, something people make up now as an excuse? And how do you feel about that?
I mean, it's a really good question to ask. I'm hardly going to say yes, because this is my day job. But the reality is, it's actually in psychiatry, this is one of the most assessed diagnoses. If you ask me about how I diagnose depression or anxiety, the kind of process that you have to go as an individual to get a diagnosis of ADHD is much more vigorous. Yeah? So I generally feel, as long as you're following the standard ways of diagnosing people, so as an adult, that's a DIVA 5.0, then you should be very confident to get the diagnosis. The other thing that we know is it's a very genetic condition, which I mentioned already, yes? So if I have ADHD, there's a 30% chance that one of my other family members have ADHD. So if I look up the spectrum, then that's someone like my dad, my mum, my uncle, or an aunt. I've got a 1 in 3 chance. So we really do know it's a very genetic condition, and in the same way, I've got ADHD, my children have got a very good chance of having ADHD as well, yes? So we know that. And if you look at population levels, depending on which country you're in, it is roughly 3 to 8% of the population have ADHD. In general, that 3 to 5% figure is the one that's kind of agreed on, but it can be up to 8%. And when you start adding other neurodiversities into it, autism, dyslexia, dyspraxia, all the other ones, the general stat is 1 in 4 is neurodiverse. So the question that often we get asked is, why is it being diagnosed more? Yes? I think in general we've got a much better understanding of ADHD. And again, I'm fairly classical in the fact that one of my children got diagnosed as neurodiverse, and a couple of years later, here I am. I'm getting diagnosed. So you have people like me in their 40s, in their late 30s, one of their children's being diagnosed, and they suddenly think, oh my gosh, this is basically me. I've somehow gone through the school system, university system, into work, and I've been missed, yes? Or I've managed, yes? And we talk about scaffolding and cognitive burdens, and we'll talk about that a bit more, yes? But it's a very genetic condition, and it runs in families. So it is not unusual if you're diagnosing one person in the family, there'll be other people. And obviously there'll be runs of families where it doesn't exist, so there's that. But I think it's just hit the press because there are such long waits, yes? And the understanding's improved. You could talk about modern lifestyle as well, yes? If we think about 10, 15, 20 years ago, what type of jobs were we doing? We were doing predominantly manual jobs, yes? And those manual jobs meant we burnt off our energy, yes? Perhaps it was perhaps more interesting than sitting in front of a computer, so our focus could shift, yes? Now we're very much computer-based in the post-COVID world, often sitting at home, yes? So we're living in a society that is making us have less in attention. Yes? There's that aspect of it as well, but there are very clear genetics, and I'm very confident in the diagnostic tools that we use.
Yeah, absolutely. And we keep mentioning this term neurodiversity, and I wanted to make clear that what we're talking about is any condition, usually a developmental condition, usually something that has to do with the development of the brain, which means that you're wired a little bit differently to the rest of the population. So we talk about neurotypical and neurodiverse, and that kind of gives an umbrella for some of these other conditions which often overlap, as you can see from the slide, with ADHD. And I remember, Asif, you were saying to me that most of the time, the diagnosis is not on its own, actually. You will often see it with other conditions, right?
Yeah, absolutely. So it is incredibly rare to see people who've just got a diagnosis of ADHD, yes? So the general stat is, if you've got ADHD, you've got an 80% chance to have a separate psychiatric condition. And as we've got those lovely circles, about 30% of people with ADHD will have autism as well, yes? So it's very common. So it's unusual just to have ADHD. And again, that's all about brain development, the way that the brain's wired, which makes it more likely to have another condition, be it a neurodiversity, or it's very common for me to see people with anxiety or depression on top of the fact that they've got ADHD.
Yeah, and I think before I was diagnosed with ADHD, the depression symptoms were definitely there. So I can really kind of connect with that.
So we've touched on the brain, haven't we? Yeah. So let's talk a little bit more about the brain and let's be a bit more specific. So tell us about that, Shermina.
Okay, so this is the brain picture. I can remember back to medical school. Let's see. Okay. So we did say it's a condition of the brain. And I think one of the things we didn't mention and is missing in the criteria, actually, is there are a couple of things. One is that as well as being inattentive and maybe hyperactive and impulsive, you can also have difficulties with what we call executive function. So your ability to organize. We'll talk a little bit more about that in a moment. And if you look at the diagram up here, so doctors are very simple, really. And what we wanted at the beginning is to just find one little bit of the brain that had a problem with it, and we could say, right, that's it, that's ADHD, that's where ADHD is. It didn't work like that. Okay. What we found over time is that actually there are several parts of the brain that are involved in ADHD, some of the challenges, okay? A key part of the brain is this bit right at the front of the brain, which is called the kind of prefrontal cortex. And that bit of the brain is the bit that helps you organize, that's around executive function. And I'm going to let Asif talk about executive function in a minute, but just let's go through this diagram a bit more. The other bit of the brain that's important is the middly bit. There you can see my anatomy is fantastic. The middly bit I'm talking about is the sort of limbic system or limbic area, the emotional parts of the brain. And again, one of the things I think that's missing from the criteria is you get a lot of what we call emotional dysregulation in ADHD. So your mood can go from happy, 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 happy to suddenly in tears, right? Or very angry. And it's much more, I mean, everybody has changes in mood, but what we tend to see in ADHD is that they're very rapid, the changes in mood. And it's because that part of the brain is involved. The other bit is the back bit of the brain, the cerebellum, which helps us with our balance and our movement. And what we know about ADHD, which is really interesting, is that some people with ADHD are very clumsy. I think I'm one of those. Okay, they have difficulties with coordination. When I had to drive a manual car, ya Allah, that was so difficult. It took me ages to pass my test. And then one day I discovered automatic, right? And I was like, wow, look at this, okay? And that's because I probably have some of the coordination issues. On the other side of it, there are people, because of that fantastic hyperactivity, who are brilliant sports people. So there's quite a few famous sports people with ADHD. So they obviously don't have the same challenges with the motor issues. And that's one thing that we've learned. You can look at 1,000 ADHD brains, and they'll all have a slightly different flavor of this wiring. And that's the big thing. It's not just the areas that are involved, but how it's all wired together. Another key area is what we call the reward center, or what we sometimes call the addiction center, okay? So what we know about people with ADHD is they're much more susceptible to addiction, okay? They are what we call dopamine seekers, yeah? They're much more likely to become, if they start on drugs and alcohol, to become addicted compared to the rest of the population. And I think this comes to a point that I'm going to come back to, which is one of the challenges with ADHD is that it's sometimes seen as a moral diagnosis, okay? So people look at someone who's hyperactive and say, oh, they're so poorly behaved. They look at a hyperactive child, they're badly behaved, they're poorly parented, you know, I'm sure people have heard it all. Similarly, if a child is daydreaming, if they've kind of lost focus, they'll say, look at them, you know, they're lazy, they're daydreaming. And I think realizing that actually this is a condition in the brain itself is really important. The other bit that's important that I wanted to talk about is there is a part of the brain that is involved in resting, okay? So what we now know, that slide I showed you is about 10 years, 15 years old. What we now know is that bits of the brain connect when we're doing things. So when we're doing a task, different parts of the brain light up. And when we're relaxing, different parts of the brain light up. And both are necessary. The relaxing parts of the brain are what we call the default mode network, okay? But it's basically the playground of the brain. It's when your mind wanders. It's when you have a bit of a rest. It's when you daydream. And everybody has that part in them, whether they have ADHD or not. The challenge is that in ADHD, the task positive network is trying to get the task done, is sort of fighting the default mode network, which wants to daydream and do masti and not really get on with whatever activity is going on. So what we now know is that there's a bit of a conflict between these two. And another challenge with that default mode network is it makes you what we call ruminate. It makes you fixate on things. And that's where we think some of the issues with ADHD and depression happen, because you get stuck in this really negative cycle, focusing on something for a long time. So that is the brain bits. Asif, did you want to talk about executive function, what that actually means? Because I think I'm using the term, but what does it really mean?
So again, it's a rather posh term for managing your day-to-day life. Yes. So we've already talked about concentration and hyperactivity, but what about managing day-to-day life? So that is, do you get to places on time? Do you lose stuff? Do you go into a room like I often do and think, why am I actually in this room? Yes? Are you messy? Can you organize your life? Do you, like I used to, pay my bills on the day that it was due? Yes? Yeah? And so that's executive functioning. So in addition to the things that we've already talked about, what people often struggle with is that, which is your general organization of your life. Yes? And again, when we're thinking about treating ADHD, we then think about not only the concentration and attention, but what is their executive functioning. And that can vary. So depending on where you are in your life, you can either manage that really well or really poorly. And then we start talking about cognitive burden. So if I think about my own life, I think about actually in my 30s, generally I did that okay. But when I got into my 40s, maybe my cognitive burden increased. So that is children getting older, I'm not doing things so well. And so my ADHD symptoms seem to come out of the blue or become more prominent because my ability to manage that has dropped. Yes? Or the systems I've put in place in my 20s and 30s don't work as well. Yes? And again, that's when people start coming to see you because they're saying, the things I used to be able to do, I can no longer do. Yes? And then that's when they get treatment. And obviously, we'll talk a bit about treatment a bit later.
So in the creative person that I am, which I think is very much part of my ADHD, I have written a poem about organizing yourself. Imagine being a woman of South Asian, Indian, an Ismaili woman who is messy. Yeah? So this is my ode to trying to tidy up. It's called Where Does It Go? Where does it go? Where does it go? Where does it go? I don't know. Up on the shelf or down below? Should it be kept or just let go? Overwhelming, crowded spaces, full of stuff from different places. Can't believe there's all this wastage. Sort it now, belts and braces. Where does it go? Where does it go? Where does it go? I don't know. Bought that book by Marie Kondo. Bags of junk I need to throw. Oh, I stubbed my toe. Right, that's it. Stuff it in a cupboard and go for a latte.
What am I going to say about treatment that's going to be as good as that movement break? Probably not very much, but anyway, let's go for it. So there are, in essence, 3 ways that you can treat ADHD. Obviously, you don't have to treat ADHD. You can say, look, I've got ADHD. As I felt, oh my gosh, this really explains my life and why I left things to the last minute, why I'm messy, all sorts of things. Why do I do too much at one go? And that whole kind of Ferrari engine. So if we take the analogy a bit too far, you wouldn't drive a Formula One Grand Prix car all the time. And that's what people with ADHD are driving their Formula One Grand Prix car all the time. And they don't have the pit stops. They're not Lewis Hamilton. And that's why often people with ADHD get burnt out. So again, that's another reason why people come. So if you want to be actively treated, there are 3 ways. One is psychological or therapy. We've started to move away from that terminology, at least in the adult world. So we talk about coaching. So you can have ADHD coaching. You can still call it therapy, but the kind of vogue term now is coaching. If you then want to think about medication, there are medications. But not everyone's comfortable having medications, and that's completely fine. It's all about choices. Often it's about how they're functioning and what kind of support they're. Then there are non-medication treatments, yes, apart from therapy. Obvious ones, exercise. Exercise is brilliant for people with ADHD. So that is trying to kind of exert the energy. Then there's mindfulness, so a way of calming things down, yes. What we're now starting to talk about are functional mushrooms, yes. So there is something called lion's mane, which is pretty good for concentration. There's chaga, which is using for energy, and there are things like reishi and ashwagandha for anxiety. And again, some people don't feel comfortable because what they often ask me is, what's the evidence base? It's weak, yes? But there are not big pharmaceutical companies producing these things. There are lots of different smaller companies. So the research isn't quite there, but in clinical practice, it does work. But what I would say is it probably works well on the milder end of the spectrum. So you obviously have mild, moderate, severe ADHD on that mild to moderate end. I also have my patients who take both traditional medications and lion's mane. Right? So ultimately, my job as a doctor is to present the individual with the options of, do you want to do nothing, which is perfectly reasonable, or do you want to have treatment? And if you want to have treatment, you've got the combination of coaching, what I would call traditional medications, and what I now call functional mushrooms. Yeah? And they're all very valid options. It's just about what you want to do as an individual.
So I think the options are a little bit different when it comes to children. They're not, there's some similarities. So I think one of the things that you first notice as a parent is some of these challenges with focus, with hyperactivity, and that's what parents come with. You know, what do I do, right? This kid is running around everywhere, they've got so much energy, or they're not concentrating, they're not learning. And we talk about kind of having tools in your toolbox to support your child, okay? And to be honest, you could use these tools even if you didn't have a diagnosis, at least in the home environment. So one of the things that Asif talked about was exercise. There are some children who just need to move. And being able to say to them, okay, you know what? Every day after we come back from school, we're going to spend half an hour, 40 minutes in the park. Trampoline, yeah, in the back garden. Some families find that really, really helpful to just get all the energy out. These are not children who can sit, many of them, like that for a long period of time. So finding activities which can actually engage them and use all of that energy is really, really important. The other thing that's important is how we parent children with ADHD, because it's an interesting balance, okay? Often, Asif, you alluded to it when you were talking about your own childhood, you need to be able to know what the boundaries are. There needs to be some kind of rhythm and routine. That's very helpful. Sort of knowing what's going to happen next and doing the same thing again and again is really helpful. It means that it becomes a natural thing for them to do, right? I think.
And that's the scaffolding term that we talked about. Yes, so that can be parenting or parenting styles, but that routine is really important. Again, often people with ADHD really struggle to sleep. So again, that routine and how you manage that routine is so important.
Yeah, and so with sleep, we talk about, shall we talk about them? Phones, okay? So we talk about the importance of actually removing all the stimulating stuff before you go to bed. So, I mean, this is good for anybody, whether you have ADHD or not, which is, can you get rid of the blue light? Can you get rid of all that stimulation that's coming from your phone or your computer or your TV at least an hour before bed, okay? With some of my teenagers, we do a lot of negotiating about charge your phone outside of your room. Yeah, so there isn't the temptation to go back there, because actually that sleep routine is hugely important. What do you do before you go to bed? So a sleep routine can be really important. But I think the other thing is thinking about how do you put all these things in place, okay? Every parent knows that if you tell your kid to come off the games or the phone or whatever, you're going to have a fight. Yeah? With an ADHD kid, even more so, they're going to be lovely and emotionally all over the place. How do you do that? And I think it's a balance. I think it's putting those boundaries in place, but knowing which fights to fight. So not doing everything all at once. Okay, so it might be that you start with a sleep routine and you get that sorted out. And then you might think about, okay, well, you know, I'd rather you were jumping on the trampoline than sitting on this computer game for this amount of time. So maybe we can negotiate, a bit of negotiation. But a key thing for me is compassion in parenting. Because what I have seen, I don't know if you have as well, in adults, is because children and young people with ADHD have these difficult behaviors that are not conventional, they are labeled lazy and naughty and all sorts of negative things, okay? And, you know, in times gone by, were parented physically, right? And you know what I mean by that. So, you know, essentially physically abused, okay? Which we probably accepted as a society before, but we know how much damage that can cause, particularly in neurodivergent children who will actually be more fight or flight. They'll get more distressed by that kind of parenting. But worse, they ruminate, yeah? So that negative voice of everybody telling them you're bad, you're naughty, you can't learn, all of these things, that goes into adulthood. That becomes depression, that becomes anxiety, that becomes low self-esteem. So the biggest thing I would say is there has to be routines, there has to be those walls. They need to know what is right and what is wrong, but you need to do it in a compassionate way. And also regulate your own emotions. So when they're exploding, you're not exploding with them. You've got a space where you've already done your explosion and you're there being calm and you're regulating them. You're saying, let's get back down to where we were. Let's do some breathing. Even in children, you can do mindfulness and breathing exercises. Yoga for children is an amazing thing. And we're seeing more and more evidence that actually these things help. And I think when you were talking about slowing down and speeding up, I think one of the things that's helped me a lot actually is learning how to slow down. Learning how to just sit and look at the tree and not think, wow, we could have 2 trees. Look, there we go. We could have 3 trees. We could, what's that? Why has it got those leaves? Which is what you do. Your mind goes into places. But learning how to just kind of focus on those moments, which actually children do beautifully, don't they? When they're very small, that's what they do. Wow, mummy, look, grass. Mummy, look, this. Daddy, look, that. That's the wonderful thing about children. So re-engaging that part of them and giving them spaces to be silly. People with ADHD make great comedians, I would say. Interesting people, and they're full of brightness and bubbliness, often very creative. So find their interest and explore that. And I think that's really important from that kind of balance. The one question we should probably do before we open it up for some questions is, I think, one of the things we talk about is ADHD, we talk about the challenges, is ADHD like a superpower? And we'll go into that, but I think one thing that we should be really clear about, today you're seeing a very strange population of ADHD, okay? You're seeing 2 people who went through medical school, who are middle class, who, achieved academically. We haven't shared all our challenges, and there were definitely challenges. There absolutely were challenges. But there are people who have even more difficult situations. So when they can't get into those academic spaces, or they don't have a nurturing parenting environment, or they're living in poverty, or they're exposed to drugs early, and so they get into addiction, okay? So we must understand that there is a huge population. I mean, ADHD is very common in the criminal justice system because people become vulnerable to addiction, to, they want to get, the impulsiveness, I want to do this, I want to get into this and that and the other. So just to say that we are not typical, okay, we are a couple of people who have been through this journey, and, we're sharing it with you. But it can be a positive. And I think, how do you feel about that superpower thing? Yeah. Should we use that term? I don't know.
It's a very interesting term. So the person I quoted, Edward Hallowell, the American psychiatrist, he quite likes that term, superpower. I think it depends on the individual. I think what I particularly like, what they talk about on one of their books is called ADHD 2.0, and it's one of the books. So that's their old book. It's called Delivered from Distraction. So it was beneficial to have the 2.0 because it's half the size, and obviously people with ADHD don't like to read. But in essence, it's the same book. But one of the things they talk about is finding your right type of difficult. And what they mean by that is you have to find what drives you. Yes? So ADHD people hyperfocus, and they go all in on a particular subject. Now, if that particular subject can be a career, that's even better. And so you have to find the right type of difficult, because if you do that, then you're then really going to work hard. Yes? So if I give you a very silly analogy, I'd be a rubbish surgeon. Yes? But I love my job, so then I'm going to work really hard at it. And it doesn't have to be your job, but it just has to be something that you enjoy doing. And often entrepreneurs, people who work, I think that's probably the buzzer to tell us to stop talking, isn't it? But entrepreneurs, actors, comedians, sports stars, they've just found the thing that they're good at and go for it, yes? But Shermina also raises the point of actually, if you don't find that, if you haven't got that nurturing environment, then perhaps you go down a different path. And I think that's why people don't like that term superpower, because maybe people haven't found it, or maybe people don't have it. So I think it's a term that is either loved or hated, a bit like Marmite, yes? I quite like it, but I tend to use you need to find the right type of difficult is the way that I use it. What are your thoughts, Shermina?
I think it really can be a superpower. I mean, we haven't bigged it up enough, but Asif winning this award, it's a national award for Psychiatrist of the Year. And Asif, I think you're 10 years younger than anyone who's won it before. So see how I have to sit next to this guy. So, I mean, but I think that is because you had this capacity to do so many things, because the award is judged on what you have been able to achieve. Would you agree?
Yeah, I mean, and I guess that's where the hyperactivity, and I think for me that's where it was different. I have a hyperactive mind. I don't have a hyperactive body, as it were. And so potentially that is my superpower. I can do certain things that maybe other people can't, and people with ADHD are creative. So I'm not creative in the way that Shermina is, but if you ask me to organise a conference, I'm your man, yes? Maybe not doing a dance, maybe not writing a poem, yes? So your creativity can be in a different way. I guess I can give you a slightly different example. One of the jobs that I left, when I left, they had to hire 4 people to do what I was doing. Yeah? The problem with that is you then burn out, and I've burnt out at least twice in my life, which again, I like that kind of Formula One car, because actually you need to kind of rest that car, you need to change the tyres, you can't be running that. It's a 2-hour max car, and you can't be, Shermina and I can't be running at that pace all of the time, yes? So there are many strengths, there are some weaknesses, but then you learn how to manage those, be it in that medication, psychological, the people around you. And again, one of the things that Edward Hallowell mentions is if you marry well, you then have a great support system, yes? So I've been fortunate that I have married well, and so I don't have to particularly worry about my life admin. I've talked a lot about my work, but my life admins are pretty much a disaster zone, but I don't have to worry about that because I've married well. Now, I'm not saying that's the solution for ADHD, is go find the right partner, but you have to know what you find difficult and then find a solution to find that, yeah, to solve that, as it were.
And I think, kind of, to give another reflection, why go for a diagnosis, right? What's the value of it? Or even why explore this, right? Why do we do that? And I suppose, Asif and my experience is slightly different. When I was young, I was that jungly girl that you saw there. And during primary school, I was very distracted. So teachers would say, Shermina would forget her head if it wasn't screwed on. Like, it was that kind of thing. And actually, especially as an Ismaili and middle class and everything else, there's expectations for you to do well academically. And my mother just decided she's not going to do well academically. She's not there. My mother would tutor other students for like 11 plus, and she'd be like, Shermina can't do this. This is not for her, right? And so that was already sort of labels were put on me, and I wasn't given the opportunity to flourish. I did quite well in my GCSEs because I'm lucky that probably I have got some of that kind of ability to learn, probably a little bit lastminute.com doing everything, but I can do that. And then we had the conversation around, well, what career do you want? And I said to my mum, I want to be a film director like Steven Spielberg. And my mother said, what? Because every migrant diaspora family says what, right? Because you want your children to be doctor, lawyer, accountant, engineer, because those are guaranteed incomes, it's a profession. There are reasons for that. But I think it actually, though I love being a doctor, and I feel very privileged to be a doctor, I think that would have been a good point to think about if that was the right kind of difficult for me. And there were bits I loved, like I loved A&E, and I loved that kind of energy thing of all of that stuff. But some of the parts of being a doctor were quite difficult for me. And should I have really kind of exhausted myself? And I think that's where the challenges lie. Would I have lived my life differently? Of course not. There's so many beautiful things that have come out of my life. But I can see where if we'd just known before, and you never know, I would have been like, Steven Spielberg, who knows? I mean, we don't know. And so I think that's the reason to go for a diagnosis, or to at least understand yourself.
Thank you very much.